Welcome to our comprehensive guide on oral surgery complications. In this video, we'll break down the various intraoperative and postoperative risks, their causes, prevention strategies, and management protocols. Whether you're a dental student, practitioner, or patient, understanding these complications is crucial for safe and effective oral surgical outcomes. We'll start by exploring soft tissue injuries, then move on to hard tissue issues, adjacent tooth injuries, major bone fractures, TMJ complications, and finally, postoperative concerns like dry socket and nerve injuries. Let's begin by understanding why complications occur and how awareness can help minimize risks. Soft tissue injuries are among the most common intraoperative complications in oral surgery. These include mucosal tears, punctures, inadvertent incisions, thermal injuries, crush injuries, and ecchymosis. Each injury type has distinct causes, such as improper surgical technique, careless instrument handling, or excessive force. Prevention relies on careful flap design, controlled force, and proper instrument handling. Management varies based on injury size and severity, ranging from simple observation to direct closure or palliative care. Let's delve deeper into each soft tissue injury and learn how to prevent and manage them effectively. Mucosal tears typically result from improper surgical technique, such as inadequate flap size or careless retraction. Excessive, uncontrolled force with elevators can also cause tears. Common sites for mucosal tears include the upper posterior palate, lower tongue, and floor of the mouth. Prevention is key. Ensure proper flap design. Use controlled force and handle instruments carefully. Small tears often heal by secondary intention without closure, while larger tears require direct closure for primary healing. Understanding the causes and sites helps minimize the risk and ensures prompt management. Preventing mucosal tears starts with proper flap design and controlled force during surgery. Surgeons must carefully handle instruments, especially retractors and elevators, to avoid excessive pressure on delicate tissues. Training and experience play a significant role in minimizing these injuries. When tears occur, small ones usually heal without intervention, while larger tears require direct closure. By following these preventive measures, oral surgeons can significantly reduce the incidence of mucosal tears and improve patient outcomes. Punctures and inadvertent incisions are often caused by elevator slipping due to uncontrolled force or lack of attention while handling surgical blades. Punctures commonly occur on the lips and cheeks, while incisions can happen anywhere. Soft tissue is exposed. Prevention involves using controlled force, proper finger rest and support, and positioning the index finger as a stop on elevator shanks. Attention to detail during blade handling is essential to avoid accidental incisions. Recognizing these causes helps in implementing effective preventive strategies. Management of punctures and incisions depends on their size and depth. Deep punctures should be left open for drainage to prevent entrapment and heal by secondary intention. Small incisions may not require suturing, while larger ones need direct closure. Applying Vaseline can help minimize scarring. Prevention remains the best approach, but prompt and appropriate management ensures optimal healing and reduces complications. Surgeons must assess each injury carefully and choose the best management strategy for the patient. Thermal injuries occur when hot instruments are used straight from the autoclave or when handpieces overheat during surgery. Crush injuries happen when lips or cheeks get entangled in forceps, especially during molar extractions. Abrasion injuries are caused by long burr shanks rubbing against soft tissues. Prevention includes cooling instruments in saline, regular maintenance of rotary tools, and adequate soft tissue retraction. Management involves palliative care, cold or hot packs, topical Vaseline, and proteolytic enzymes like serratiopeptidase. Recognizing and addressing these injuries promptly is vital for patient comfort and recovery. Ecchymosis is a result of secondary internal bleeding and typically absorbs spontaneously within 1 to 2 weeks. Management includes cold or hot packs and reassurance for the patient. Surgical emphysema occurs when air is pushed into tissue spaces, often from air-driven turbine drills. It develops rapidly and is characterized by a crackling feel under the skin. Prevention involves avoiding air-driven turbines for bone or tooth sectioning. Understanding these complications and their management helps ensure patient safety during oral surgery. Hard tissue complications involve fractures of teeth and roots, displacement into spaces or sinuses, and swallowing or aspiration of teeth. These issues often arise from inappropriate or excessive force, abnormal root morphology, or lack of prior elevation. Management guidelines emphasize removing all roots unless hazardous, considering tooth vitality, root length, infection status, and patient cooperation. Informing the patient and documenting retained fragments is essential. Let's explore each hard tissue complication in detail and learn how to manage them effectively. Fractures of teeth and roots are common during extractions, especially when excessive force is used or prior elevation is neglected. Carious lesions, large restorations, devitalized or ankylosed teeth, and abnormal root morphology increase the risk. Ideally, all root fragments should be removed unless their removal poses a hazard, such as proximity to the inferior alveolar nerve or antral floor. The decision to remove or retain fragments depends on tooth vitality, root length, infection status, and patient cooperation. Always inform the patient and document any retained fragments for future reference. Teeth or root fragments can be displaced into anatomical spaces like the submandibular space, pterygopalatine fossa, or infratemporal fossa, especially when the lingual cortex is thin. Immediate retrieval or referral to an oral and maxillofacial surgeon is required. Displacement into the maxillary sinus is particularly common with palatal roots of maxillary first molars or teeth with splayed roots near thin antral floors. Confirmation involves the nose blowing test, but avoid over-enthusiastic blowing to prevent further breach. Never probe blindly into the sinus. Timely intervention is crucial for preventing complications. Swallowing or aspiration of teeth and root fragments is a critical airway emergency. Aspiration into the tracheobronchial tree requires immediate referral to a chest surgeon for bronchoscopy. If swallowed into the gastrointestinal tract, a gastroenterology consultation is necessary. Prompt identification and management of these emergencies are vital to prevent serious complications. Surgeons must always be prepared to handle such situations and ensure patient safety throughout the procedure. Injuries to adjacent teeth and restorations can occur during extractions, especially when elevators or forceps are misapplied. These injuries may result in subluxation, luxation, or fracture of neighboring teeth. Management involves stabilizing affected teeth with wire or acrylic splints and planning endodontic therapy if needed. Extraction of the wrong tooth is a serious error, often caused by carelessness or poor communication, particularly in orthodontic referrals. Always check charts, mark teeth with indelible pencils, and inform the orthodontist and patient immediately if a mistake occurs. Extracting the wrong tooth is a preventable complication. It often results from poor communication or misidentification, especially in orthodontic cases. Management includes immediately replacing or reimplanting the mistakenly extracted tooth, checking charts, and marking teeth with indelible pencils. Inform both the orthodontist and the patient about the error. Prevention is always better, so double-checking and clear communication are essential steps before any extraction procedure. Major bone fractures, such as those of the maxillary alveolus, tuberosity, or mandible, are rare but serious complications. Maxillary tuberosity fractures are often associated with over-erupted molars, large antra, or excessive force. Management depends on whether the bone is attached to the periosteum. If attached, reposition and suture. If detached, remove the segment. For large segments, abandon extraction smooth edges, and defer surgery for 6-8 weeks. Mandible fractures require radiographs, patient notification, and treatment via reduction and fixation. Instrument breakage, such as broken burr tips or elevator fragments, can occur during oral surgery. Retrieval of broken fragments is essential to prevent further complications. If retrieval is not possible, refer the patient to an oral and maxillofacial surgeon for debridement. Regular maintenance and careful handling of instruments help minimize the risk of breakage. Always inspect instruments before and after procedures to ensure their integrity. Temporomandibular joint, TMJ, injuries can occur during difficult extractions or when jaw support is inadequate. Pain is often due to stretching of the capsule and is managed with rest, a soft diet, hot fomentation, and analgesics. Dislocation is common under general anesthesia or during challenging extractions. Reduction involves pushing the mandible downwards and backwards while rotating the chin upwards. Patients should be instructed not to open their mouths widely for a few days to prevent recurrence. Late supine hypotensive syndrome, LSHS, occurs in late pregnancy due to fetal pressure on the inferior vena cava. This can lead to decreased venous return and cardiac output. Management involves turning the patient to one side or elevating them, which restores venous return and cardiac output immediately. Awareness of LSHS is crucial for oral surgeons, especially when treating pregnant patients. Prompt action ensures patient safety and prevents complications. Hemorrhage during oral surgery can occur from bone or soft tissue. Bone bleeding is controlled with pressure gauze packing, bone crushing, or burnishing with hemostats. Absorbable gelatin sponges like Gelfoam or Surgicel, and bone wax. Use bone wax sparingly due to infection risk. Post-extraction instructions include biting on a gauze pack for 10 minutes to form a stable clot and avoiding vigorous rinsing, touching, or chewing. Proper hemorrhage management ensures patient comfort and reduces postoperative complications. Postoperative complications in oral surgery include dry socket, alveolar osteitis, and nerve injuries, particularly to the inferior alveolar and lingual nerves. These complications can cause severe pain, foul odor, and nerve dysfunction. Understanding the risk factors such as trauma, smoking, vasoconstrictors, and oral contraceptives is essential for prevention. Management protocols focus on monitoring recovery and providing appropriate interventions when necessary. Let's examine these postoperative complications in detail. Alveolar osteitis, commonly known as dry socket, is characterized by severe throbbing pain, foul odor, and disintegration of the blood clot, exposing bare bone. It is linked to bacterial factors, trauma, smoking, vasoconstrictors in local anesthesia, and oral contraceptives. Management involves palliative care, pain control, and promoting healing. Preventive measures include gentle surgical technique, avoiding trauma, and educating patients about risk factors. Early recognition and intervention are key to minimizing discomfort and promoting recovery. Nerve injuries, particularly to the inferior alveolar and lingual nerves, are risks during third molar extractions, flap elevation, or bone cutting. These injuries can lead to numbness, tingling, or loss of sensation. Management involves monitoring recovery over 2 to 6 months. Severe cases may require microsurgical anastomosis, grafting, or nerve decompression by an oral and maxillofacial surgeon. Early identification and referral are crucial for optimal outcomes. Preventing complications in oral surgery requires meticulous planning, careful technique, and thorough patient assessment. Surgeons should design proper flaps, use controlled force, and handle instruments with care. Regular maintenance of equipment and clear communication with the surgical team are essential. Educating patients about postoperative care and risk factors further reduces the likelihood of complications. Prevention is always preferable to management, and a proactive approach ensures safer surgical outcomes. Effective communication with patients is vital throughout the surgical process. Surgeons should explain the risks, preventive measures, and management protocols for potential complications. Informed consent and clear instructions help patients understand their role in postoperative care. Documenting any intraoperative or postoperative issues ensures transparency and builds trust. Good communication also aids in early identification and management of complications, leading to better outcomes. Proper documentation is essential for legal and clinical reasons. Surgeons must record all intraoperative and postoperative complications, management steps, and patient communications. This ensures accountability and provides a clear record for future reference. Legal considerations include obtaining informed consent, marking teeth accurately, and documenting any retained fragments or errors. Thorough documentation protects both the patient and the practitioner. Maintaining surgical instruments is crucial for preventing complications like thermal injuries and instrument breakage. Regular inspection, cleaning, and proper storage ensure that instruments function correctly during procedures. Surgeons should avoid using hot instruments straight from the autoclave and check for wear or damage before each surgery. Well-maintained instruments contribute to safer and more efficient surgical outcomes. Successful oral surgery relies on effective teamwork. Surgeons, assistants, and support staff must communicate clearly and coordinate their actions. Each team member should understand their role and responsibilities, from instrument handling to patient monitoring. Teamwork reduces errors, enhances efficiency, and ensures patient safety. Regular training and debriefing sessions help maintain high standards and foster a collaborative environment. Thorough patient assessment is a cornerstone of complication prevention. Surgeons should evaluate medical history, oral health status, and potential risk factors before surgery. Identifying conditions like osteoporosis, deep impactions, or pregnancy-related risks allows for tailored surgical planning. Preoperative assessment ensures that the surgical approach is safe and appropriate for each patient, minimizing the likelihood of complications. Clear postoperative instructions are essential for preventing complications like dry socket and hemorrhage. Patients should be advised to bite on a gauze pack for 10 minutes, avoid vigorous rinsing, touching, or chewing, and follow prescribed medication regimens. Educating patients about signs of complications and when to seek help ensures timely intervention. Good postoperative care leads to faster recovery and fewer adverse outcomes. Pain is a common complication after oral surgery. Effective pain management includes prescribing analgesics, recommending hot fomentation, and advising a soft diet. For TMJ pain, rest and avoidance of wide mouth opening are important. Surgeons should tailor pain management strategies to each patient's needs, ensuring comfort and promoting healing. Monitoring pain levels and adjusting treatment as necessary helps achieve optimal outcomes. Emergencies such as aspiration or major hemorrhage require immediate action. Surgeons should be familiar with emergency protocols, including referral to specialists, airway management, and bleeding control techniques. Having emergency equipment and trained staff on hand is essential. Regular drills and protocol reviews ensure readiness for any situation, safeguarding patient health during and after surgery. Certain complications, such as displaced teeth into anatomical spaces or severe nerve injuries, require referral to oral and maxillofacial surgeons or other specialists. Timely referral ensures that patients receive expert care and reduces the risk of long-term complications. Surgeons should maintain a network of specialists and know when to seek additional help for complex cases. Educating patients about oral surgery risks, preventive measures, and post-operative care is vital. Providing written instructions, discussing potential complications, and answering questions help patients feel informed and prepared. Patient education empowers individuals to participate actively in their recovery and recognize early signs of complications, leading to better outcomes. Identifying risk factors such as smoking, trauma, vasoconstrictors, and oral contraceptives is essential for preventing complications like dry socket and nerve injuries. Surgeons should assess each patient's risk profile and adjust surgical techniques accordingly. Awareness of risk factors allows for targeted prevention and tailored postoperative care, reducing the incidence of adverse events. Continuous improvement of surgical technique is key to minimizing complications. Surgeons should stay updated with the latest protocols, attend workshops, and practice skills regularly. Proper flap design, controlled force, and careful instrument handling are fundamental. Investing in ongoing education and skill development leads to safer surgeries and better patient outcomes. Monitoring patient recovery after oral surgery is essential for early detection of complications. Surgeons should schedule follow-up appointments, assess healing progress, and address any concerns promptly. Recovery monitoring includes checking for signs of infection, nerve dysfunction, and proper wound healing. Timely intervention ensures optimal outcomes and patient satisfaction. Reporting complications is a critical aspect of clinical practice. Surgeons should document all intraoperative and postoperative issues, management steps, and patient outcomes. Complication reporting contributes to quality improvement, research, and education. It also ensures transparency and accountability within the surgical team and healthcare system. Quality assurance in oral surgery involves regular review of protocols, complication rates, and patient outcomes. Surgeons should participate in audits, peer reviews, and continuing education to maintain high standards. Quality assurance ensures that best practices are followed and that patient safety remains the top priority. Ensuring patient satisfaction involves providing excellent care, clear communication, and prompt management of complications. Surgeons should listen to patient concerns, address issues quickly, and follow up regularly. Satisfied patients are more likely to adhere to postoperative instructions and report complications early, leading to better outcomes. Continuous education is vital for oral surgeons to stay updated with evolving techniques and complication management protocols. Attending workshops, conferences, and online courses helps maintain clinical competence. Surgeons should encourage lifelong learning within their teams to foster a culture of excellence and safety. Intraoperative complications are issues that arise during the surgical procedure itself. These include soft tissue injuries, hard tissue fractures, displacement of teeth or roots, instrument breakage, and TMJ injuries. Understanding intraoperative complications is essential for prevention and effective management. Surgeons must be vigilant, skilled, and prepared to address these challenges promptly. Postoperative complications occur after the surgical procedure and include issues like dry socket, nerve injuries, hemorrhage, and infection. These complications can significantly impact patient recovery and satisfaction. Surgeons must educate patients, monitor healing, and intervene promptly when complications arise. Understanding postoperative risks is key to providing comprehensive care. Prevention and management are the twin pillars of complication control in oral surgery. Prevention involves careful planning, technique, and patient education, while management includes prompt intervention, documentation, and referral when necessary. Surgeons must balance both aspects to ensure safe and effective surgical outcomes. Proper flap design is crucial for preventing soft tissue injuries during oral surgery. The schematic illustrates the ideal flap size, controlled force application, and careful instrument handling. It also highlights common sites of mucosal tears and demonstrates how to avoid excessive pressure on delicate tissues. This visual guide reinforces the importance of technique in minimizing intraoperative complications. In summary, Oral surgery complications can be minimized through careful planning, skilled technique, and effective communication. Understanding intraoperative and postoperative risks, implementing preventive strategies, and managing complications promptly are essential for patient safety and satisfaction. Continuous education, teamwork, and quality assurance further enhance surgical outcomes. By following these guidelines, oral surgeons can provide safe, efficient, and patient-centered care.